My name is Jerad Halcott. I organize rural communities with Progressive Maryland, which is part of People's Action. We're here because we've seen the impact of the war on drugs in our community, and the overdose crisis now kills more Americans than car crashes or gun violence. That ain't right.
That ain't right.
I know the impact of the war on drugs. I've personally sold my body for drugs, stolen from people, and turned my best friends into heroin. I'm a long way from that life now, but I still live in a world impacted by this crisis. On my arm here is one of my best friend's names, Danny Waybright. Danny hung himself last year after his mother's house was raided for a minor cannabis grow. Danny has struggled for years with heroin, and it all was just too much in the end. After Danny and several other friends and family died in the last 2 years, I asked myself, what can I do? I knew that needle exchanges are proven to reduce overdoses and the spread of disease. They can also create relationships with the people in the community that leads them to a better life.
Yes.
So I bought a box of needles and I gave it away. And then another,
Right.
and another. That grew. Now 47 other people make sure they're available in any way they can for our community. We try to go to places where we hear people are overdosing, and we try to be extra supportive. But we're fully self-funded and essentially an act of civil disobedience.
Yes.
We're waiting for the counties in my state to individually start their harm reduction, and we're just filling in the gaps. It's hard. In my community, people are dying in the places we can't be. My friend James Lawson was the person who initially inspired my work because of his overdose on fentanyl. If we had the CARE Act then, they could have put fentanyl test strips or Narcan in his neighborhood. He wouldn't have had to die.
Yes.
I had another friend who took his life. He wasn't a drug addict, but he grew up in a family with addiction. He didn't have the head start other people had. He spent much of his life trying to make up the ground that was lost by the impact of addiction in his family. It wasn't until 2 days ago when he decided to end what he thought had become a burden on his family. The effect of addictions are systemic and long-lasting. To respond to this crisis, we need giant solutions on the scale of this problem. The CARE Act would allow people impacted by addiction to have a say in how we'll take care of the problem. It will prioritize help to groups that have been historically oppressed, because let's be honest, it wasn't an opioid epidemic until people who looked like me started to die.
Yes.
Take your time, bro. Take your time.
It'll give us $10 billion a year to encourage help to people and encourage the creation of safe shooting sites. If this becomes law, we'll be able to provide naloxone to communities in a responsive way. We can invest in people in the community that gives them the hope they need. So what's at stake if we fail? Every one of the people I named today had children. I've held every one of those people's children after they passed away. Some of them stood in here in D.C. with me earlier this year in support of the Medicare for All Act. Some of their family are here with me today. If we don't invest in the CARE Act, there'll be an entire generation of kids whose parents are gone because of the war on drugs. If we fight and we win for this and the other important things we need in our communities, then we can create a better tomorrow. Let's not see this generation of kids grow without their parents. Let's end the drug war. Let's end the overdose crisis.